Good evening, everybody. Thank you. And I want to welcome you all to an MS Views and News educational program. We do want to thank Celgene. Celgene supported tonight's program, and I hope that you'll all thank them too. Give a little, hey, thank you. Great. All right. In addition to Celgene as the provider of this program, giving us the ability to do this program, we also had two exhibiting sponsors tonight, and that would be Mallinckrodt, and Jason's in the back of the room, and we had Metro Infusion. And Metro Infusion is starting to get involved with a lot of our programs. They do infusions. So for anybody that's doing an infusion medication, it's a place that you may want to check out and see how they could be beneficial for you. Okay, next, we have two speakers speaking tonight. We have Laura Bunso, and she's a physical therapist, and we have Megan Weigel, whom you all definitely do know. Megan Weigel, nurse practitioner and doctor of nursing practice, MS certified nurse, advanced practice, holistic nurse, past president of the International Organization of MS Nurses. She's the founder of the First Coast Integrative Medicine, an evidence-based traditional medical and holistic practice providing care to people living with neurological conditions and symptoms. So let's welcome Megan, whichever way you want to go.
Oh, yeah, it's on. Thanks, Bill.
However you like to go.
Okay. Thank you.
Thank you.
Thank you.
Thank you.
You're awesome. He told you the truck story? Yeah. So sweet. I'm going to make it like the special truck, so. So Stuart always asks me to talk about a lot of things in this little itty bitty amount of time. So I don't know if he's noticed it or not, but I call it Stu's or MS Views and News Soup of the Day. So I am so thankful to Laura for coming today and saying all the hard words. I don't have to say any of those hard words to you guys because she did the hard work. But super, super effective. One of the reasons that people living with MS become isolated is because they don't want to have accidents. They might feel like they have to map out everywhere that they go before they go, just in case they have to go to the bathroom and they have to get there quickly. And I think that, really it's preventive therapy, maintaining bowel and bladder control. And we'll talk a little bit in my talk as well about some additional things that you can do with diet. But our soup of the day is women's health. And I'm going to cruise through some of it because Laura already hit those pieces and did a much better and more comprehensive job than I could do. We're going to talk about your support team, integrative medicine, and then comprehensive care in MS. And it all sort of fits together because we started off the talk with part of your comprehensive care team, which is a physical therapist. And in Laura's case, she's super specialized in pelvic floor therapy. And really what I've seen in her practice is also a movement towards not necessarily just getting you better from an injury, but an empowerment to keep you feeling healthy and to give you the resources that you need to do that. So women's health issues in MS. Even women that are here in the room that don't have MS can probably understand some of this stuff, right? So women have a life cycle, and I hate to be blunt about it, but it's kind of what happens, and this picture really speaks to it. So you have a little girl holding her mom's hand. You have an older woman who's sitting on the bench. You have, a young adult who's running. You have a new mom who's pushing a baby carriage. And throughout that life cycle, we have different expectations of things that happen. And we also have different risks, different things that just are going to go on in our lives. Living with MS and being a woman throws in additional issues, and sometimes they happen sooner. So many women who are perimenopausal or menopausal have difficulty with bladder function and sexual function even without MS, but women living with MS may experience those things more sooner. Maintaining physical health and mental health is also really important. So the female life cycle in MS is complicated by, having multiple sclerosis, having to take perhaps many medications for your MS symptoms, disease-modifying therapies, worrying about relapses. Perhaps you're thinking about having a family. Perhaps you're worried about being pregnant, and then what's going to happen to me later in life, and can I take care of my children? And it's just this like endless hamster wheel of things that happen and keep you concerned. And this may even include for women, do you want to have children? I find in my age group, so I'm in my into my mid 40s. And many of my friends that I've grown up with, I've known them for 20 plus years, have decided not to have children. And so I always put that in there because I've read many articles within the past couple of years about women who decide not to have children and what kind of, or maybe they can't have children, and what kind of social stigma they face, because people, you get married and then what happens? When are you gonna have a baby? So that's a decision that many women will make. Birth control and medication interactions are real when you're in women of childbearing age. So fortunately, with the disease-modifying therapies, there aren't drug interactions with birth control. However, modafinil or Provigil lowers the effectiveness of birth control. Some of the seizure medications that we use to treat pain can either lower the effectiveness of birth control, or birth control can increase the level of those medications in your bloodstream, which can make you dizzy and more tired and things like that. And so you have to think about all of those things. And then the fact that if you want to get pregnant or want to try to get pregnant, you really need to come off most of your medication, because medications, nobody signs up for the clinical trial where you get to stay on all your meds and get pregnant and see what happens to the baby, right? So we know a few medications are fairly safe, we think, in general, but when it comes to multiple sclerosis, most medications are not safe to remain on while you're pregnant, and that includes medicines for symptoms as well as disease-modifying therapies. Although now that some of our older disease-modifying therapies have been out for so long, we're starting to understand that if the risk of MS outweighs the benefit of coming off the drug, then sometimes you stay on the drug while you're pregnant. It's a very case-by-case basis. When you're on a disease-modifying therapy for relapsing MS and you want to get pregnant, you really should plan the pregnancy, because we need you to be off the drug for the period of time that allows the drug to get out of your system. Or if you are on Aubagio or teriflunomide, then we can rapidly eliminate the drug, which gives us a safe expectation that you no longer have a drug level in your body. That being said, we tell people, families living with MS, that they should use reliable contraception, effective contraception. And, there have been a lot of babies born to a lot of women who said they were doing those things. I can bring Laura back up here if you want to say the hard words. So anyway, it's just important that you start to, that you family plan. So for those of you who are not in that phase of your life, pass that on to other people living with MS. MS can affect child rearing, or you can worry about MS affecting child rearing. Increased family and role responsibility depending on what your symptoms are. And some of these things are just worries. And they very much depend on disease severity and your symptoms, and also your support team at home. A couple of things, this brings it back to the comprehensive MS team, but I take care of a woman who's just a couple of years younger than me, who has had MS for probably, I think, 10 or 11 years. And she was told by her neurologist, who was not an MS specialist, that she should just forget about having children. And I mean, that was just devastating to me when she was told that, because it's not true. Having children does not affect, let me rephrase it in a different way. You having MS does not affect your child. So there is a genetic component to MS, and there is a slightly increased risk for children of parents living with MS or families who have MS in them. But you can't hurt your baby because you have MS and you're going to have one. It's an old wives' tale that epidurals cause you to have a relapse. There's just all these old wives' tales out there. And the fact is, people living with MS usually feel really good when they're pregnant. The risk of relapse after pregnancy is directly related to how well you were doing before pregnancy. About 25% of people will have a relapse within that first trimester after having a baby. So after having a baby, that means most people don't have a relapse. And then there's a lot that goes into that as far as when you restart disease-modifying therapy, whether or not you're breastfeeding, and how long. So, but that is a real concern for women because they hear these old wives' tales that just aren't true. It's perfectly wonderful and possible for you to have a baby when you have MS. Having MS doesn't make you less fertile, that sort of thing. And then we move into the latter half of our life, which is perimenopause and menopause. And I get asked this question all the time, oh my God, is this MS or am I starting menopause? Because people are having hot flashes, they're having trouble sleeping at night, they're waking up in the middle of the night, they're tolerating heat less well. And the answer is we really don't know unless the history tells us or a lab result tells us. So if you lose your period, you haven't had a period for several months in a row, you definitely need to see your women's health provider, be it your family care provider or your gynecologist. And there are lab tests that can be done to measure your hormone levels to see if you're in menopause or if it's more of a perimenopausal picture. But the deal is, when you have MS and you start having hot flashes, what does it do to your MS symptoms? Doesn't make them feel so good. There is data that it's kind of conflicting. So there's data that says that menopausal symptoms decrease quality of life in people living with MS. There's data that says there is no change. But I think most of us who are women know that even around periods, like PMS symptoms, PMS time, MS symptoms will flare. You may feel more tired, more spastic, more crampy, more pain, more moody, those sorts of things. So hot flashes, fatigue, moodiness, who do you call besides your best friend or your sister, right? So first, talk to your neurologist or your MS care provider because sometimes there could be another medical problem going on. Maybe you could have a thyroid issue. Maybe you're on a drug that has side effects that causes these things that you've just started, or maybe you've increased a dose. And then if it's found that it's not a neurological issue, then again, it's time to check in with your family care provider, your GYN, whoever does your women's health care. And what are your options if you're perimenopausal or if you're menopausal? Well, it kind of depends on what you are. Your options could be hormone replacement therapy for a short period of time, and that could be low-dose birth control pills, or it could be combination hormone replacement therapy, or if you no longer have a uterus, it could be estrogen replacement therapy, and this all depends on your history of breast cancer, uterine cancer, endometrial cancer, cervical cancer, your family history of those things, your genetic history. And so there are also some good supplements, herbs, and medications to help with menopausal symptoms. So your options are large for these symptoms. Or your options are many, I should say. So Laura covered bowel, bladder, and sexual function. I'm going to breeze through it here. She talked about what happens with your bladder. Failure to store, failure to empty, or dyssynergia, which is just like nobody's listening. So you have both things going on. And how do you treat it? Well, pelvic floor rehab for me is the number one thing because many of the medications that we use to treat bladder issues cause dry mouth, constipation. Over time, they can increase your risk for dementia depending on the medication. And so that just kind of worsens problems, right? Staying hydrated, which seems counterproductive, but if you don't drink water, your urine becomes more concentrated and it irritates your bladder. Removing irritants, Laura mentioned foods, drinks. So like this week I've been drinking a ton of coffee because I'm out doing talks and it's late and I'm tired, and then I have to go home and write notes. And I can tell you that when I get back into my normal routine of having a cup or two of coffee in the morning, you're not going to see me going out there so much to use the bathroom. So it's real, even for people without MS, even for men. Some other things are artificial sweeteners are really irritating to the bladder. Sometimes people find spicy foods to be and citrus foods to be. So just, watch what works for you and what doesn't. In MS, constipation is the most common bowel complaint. Sometimes incontinence of stool can occur, or you can have a hard time controlling your stool. Sometimes that's because you're constipated. The other thing that's very common in general is irritable bowel syndrome, and people may have constipation predominant or diarrhea predominant, and that can be very well managed with food, with changing your diet. Treatments for bowel issues, and I'm speaking just to constipation here, are staying hydrated, because you need water to get into your stool so that it can move through your system, increasing your fiber intake. And you shouldn't increase your fiber intake without water, because then nothing happens and it's really uncomfortable. And we'll leave it at that. Moving your body, so exercise or movement, even stretching will help your bowels move. And then medications according to your problem. So stool softeners, bowel stimulants like Miralax, laxatives or enemas. But man, I'll tell you, enemas, you can really get in trouble with enemas, and it's kind of like once you start using them, it's hard to get away from them, and you can injure your muscles basically, and then not be able to hold anything in. So be sure to start talking about constipation as soon as it starts happening to you, if it does. In women, sexual function in MS can be limited by a decreased drive for sex and sexual function, a decreased sexual response, meaning you just have lost feeling in your perineum, or you've lost feeling in other parts of your body, or your feeling has changed. So what used to be a soft touch feels really irritating, or what used to feel good burns. Anorgasmia, or the inability to have an orgasm. And these things may be from MS, like from a lesion and where it is. It may be from burden of disease, meaning all of the lesions you have together. It may be from psychological issues, about up to, I'd say it's reported 41%, but I think probably more women in general can't reach or have a hard time reaching orgasm in our country. And a lot of it is just too much going on up here. Or the wrong things going on up here. And then side effects of medication. So most of the medications that we give you to help improve your mood, help improve your pain, help improve your spasticity, help make your sex drive worse, help make your sexual response worse. So some of the treatments are pelvic floor rehab, being really communicative with your partner, and talking about different ways to enjoy a sexual experience. One of the things that you can read about is called body mapping, which is basically just spending some time with one another and touching each other and figuring out what feels good and what doesn't, and then you know. There are also counselors that are certified sex therapists, and they can be very helpful to help you work through some of the psychological issues that prevent you from enjoying sexual activity. And then counselors, if you're having issues communicating with your partner, and that's really the issue, then just regular couples counseling can be very effective. I think evaluating your medication list is also a good way to go. So maintaining physical health and mental health are pretty much the same. They very much overlap. So maintaining physical health for women includes primary care visits once a year or more frequently if you have other medical conditions, screening at recommended intervals for things for prevention. So preventing colon cancer, preventing breast cancer, preventing cervical cancer, pap smears, mammograms, bone density tests, colonoscopies. Eating healthfully, moving your body for 150 or more minutes per week, which equates to about 22 minutes per day. It's not that hard, and it counts. it counts. If you're moving, it counts. So you don't have to be a triathlete. You don't have to be out in the heat sweating. You don't have to be, banging it out on the stationary bike at a gym. You can simply be doing some exercises at home in a chair if that's what you can do. You can be having your support partner move the parts of you that don't move so well anymore. You can stretch as long as you're moving your body. Getting adequate sleep and being mindful, and that means practicing stress reduction techniques. Maintaining mental health, guess what? It's the same thing. So physical health maintenance, healthful eating, there is a growing body of literature suggesting that eating healthfully is improving mood, depression and anxiety and attention deficit disorder, and even autism. So when I was in nursing school back in the 90s, pain became the 5th vital sign. And, with the current crisis in our country with opiates, it is still the 5th vital sign. But in my mind, the 6th vital sign is sleep. And if we don't assess sleep, we're doing you a disservice. Because if you're not sleeping well, your body is sort of always in that fight or flight place, always revved up and ready to go. Your brain doesn't get a chance to rest. Your body doesn't get a chance to rest. And there are reasons for not sleeping that could involve pretty serious cardiac issues or respiratory issues. Also to help maintain mental health, counseling, social support, and then I can't say enough about the power of gratitude, the power of positive thinking, the power of kindness, and what it can do just for your insides, for your inner parts, for your soul, for your heart, and sharing those things with other people. I think we've all had the experience where you walk into a room with a person and you just are like, whoa. They don't even say anything, but you just know that the mood is not good or the day was bad. And so trying to really work on practicing a way to project gratitude, not just within yourself, but also to other people. And then we all start to feel it and everybody feels a little bit better. So integrative medicine and MS is really... it's really not that weird. And so I have a mentor. Her name is Sarai Stancic. She's a physician in New Jersey. She has multiple sclerosis, and she's very active in the American College of Lifestyle Medicine. And she said to me, what we do is we tell people to eat better food, to exercise more, to practice mindfulness and decrease their stress levels, to get good sleep. We help them do those things. We tell them to quit smoking. We tell them to slow down on drinking or stop drinking. And there's nothing woo-woo about that. There's nothing alternative about that. It's actually just what we all should be doing. So the way I practice focuses on the least invasive, least toxic, and least costly methods to help facilitate health. And in my practice, I'm trained in traditional medicine. And so I completely bring that platform in to also knowing that there are other things that can help you, like nutrition, again, mindfulness, exercise, perhaps seeing someone who's a complementary and alternative provider like an acupuncturist or a Reiki therapist. And I do all of this knowing that there is a body of evidence for some of these things in MS, and there is not for some of these things in MS. So I have to be real careful about which ones I pick. And I think, are they safe for you? Like not just you, the room, but you literally, based on your beliefs, based on the medicines that you're taking, based on your other health conditions, and based on what you tell me is beneficial for you. So to me, that's integrative medicine. It takes a lot of time. And hopefully in 10 years, but it'll probably take longer, we won't be calling it integrative medicine. We'll just all be doing it. Complementary and alternative medicine is used by about 30 to 80% of people living with MS. 90% of people who use complementary and alternative medicine also use conventional medicine. But many people choose not to tell their their clinicians, like their MSologist or their family doctor, that they're using something else because they don't want to be talked out of it, or they don't want to be told it's weird, or it's just, it's still a little bit taboo, which is interesting, because many of the things that we do really resonate with each one of us individually as a person, and that's just so important to bring into your well-being and your health care. I think probably what we need to be most careful of in this world of integrative medicine, functional medicine, alternative medicine, lifestyle medicine, complementary and alternative medicine, call it what you will, is there's so much information readily available on the internet, on social media, on shows on television, telling you that if you take X, Y, or Z, it's going to reverse A, B, or C. And so what I see is people come in and they have a box of supplements that they're taking, and reading not always, like on the front of the supplement, for example, it might be CoQ10, and they're, I'm taking CoQ10, I turn it around, and there's way more than the recommended daily allowance of vitamin A, which is very easy to get toxic levels of, way more than the recommended MS allowance of vitamin C, vitamin E, which some people just should not take. And so people don't know to do that. So I think that's the most worrisome part for me about what I'm doing, is people just maybe listening to a podcast and saying, I have hot flashes, I'm going to take that black cohosh, or I'm going to start, eating this kind of food all the time. And they don't do it without someone who has an expertise in that area looking at, well, is this going to interact with your medicines? Or, there are herbs and botanicals are really potent and they're really wonderful, and they can be used safely, but you have to make sure that they can be used safely, right? So that being said, in MS, we try to avoid things that boost your immune system, because guess what? Your immune system doesn't work right. So why would we want to help it work wronger? That's it. I feel like at some point in my life, I'm going to figure this out. Some really smart immunologist is going to tell me that when a person is stable on a disease-modifying therapy, there's going to be a way to measure something, and then I can say it's safe to take X. But right now, we don't know that. So MS throws a whole different little, safety glitch into the supplement, herb, and botanical game. But what's cool about complementary and alternative medicine, I'm not sure that I didn't put the slide in here. But most of the things that you see on the list, like prayer, yoga, Tai Chi, osteopathy, massage therapy, Reiki, those things can't hurt you. They sound wonderful, right? If you're doing them on a regular basis. So that's the good part about what I'm doing. The less scary part. The challenges for me are that there is not a lot of evidence for many things in integrative medicine and MS. Many of my colleagues think it's a gray area, or they think it's voodoo medicine. It's easy to get bogged down in the details. And people come in and they say, hey, I want to be tested for these SNPs. And I'm like, how did you know what a SNP was? It's just the information is so readily available now. And when someone wants it, they want it. And even my saying, I'm not sure that we need a $500 or $1,200 lab test to know that if you do these things for yourself, you're going to feel better. But some people want that stuff. Perceived side effects of drug interactions with supplements and botanicals, and by that I mean anyone who takes Coumadin, you're basically told never to go down that aisle. Just don't go down, don't look, don't breathe, just don't go down that aisle. For many things it's true. Quality of intervention, so we look for are the people that we're referring to, are they good? Are they reputable? Are they certified? How long have they been in practice? And are they practicing safe alternative medicine as well? And then taking a look at the number of prescription medications that are actually associated with nutritional deficiencies. So proton pump inhibitors like omeprazole, rabeprazole, pantoprazole will change the way your body absorbs B vitamins, magnesium, both really important. Beta blockers can affect thyroid function. All of these, metformin can also affect the absorption of certain minerals. And these are drugs that are pretty common. So many times I'm just doing testing to see if people need some, increased mineral supplementation, or looking for nutritional deficiencies that may cause problems. So complementary medicine, complementary management in MS is careful examination of the evidence that's out there for you, that's applied in an integrative setting to provide best care for you. So it's very individualized. It isn't piling supplements onto medications when there's no evidence for benefit. It isn't telling you to do a fad diet and eliminate healthy food groups if it's not necessary. And it's not throwing caution to the wind because of a person that you saw on YouTube that said it worked for them. And so really there's just a lot of evaluation that occurs. Recommendations for me when I see a person include reviewing your whole history, like back to childbirth. Doing a physical exam, ordering labs if necessary, and imaging if necessary, making nutritional, exercise, and mindfulness recommendations that are tailored to you, suggesting supplements if needed or if indicated, and then based on what your beliefs are and what you want to do, suggesting other forms of complementary and alternative medicine. So this brings us to the comprehensive MS care team. Comprehensive MS care is integrated, it's interdisciplinary, but it's self-empowered. So it gives you comfort in knowing that you know where to find all your people. And you have all those people in case you need them. It fulfills needs that change over time. And one of the things that I would hear most frequently in practice is, I would suggest, well, since we're women's health bladder issues tonight, we've tried a couple of medicines for your bladder. I think you need to see the urologist. No, I don't want to see one more doctor. I'm tired of seeing doctors. I have enough doctor's appointments. I'm not going to another specialist. And then when we get to, well, you've had 5 UTIs this year and your kidney function is getting bad and we need a urologist, you're either in the hospital or it's 3 months till you can see one. So it's much better to have that person be a part of your comprehensive care team before you really need him. Because once you really need him, it's either going to really affect your health or you're not going to get him when you want him, right? Or her. It is comprehensive MS care is principal versus primary care. Again, many people with MS will say to their MS provider, can't you just be my primary care doctor? Well, it's Women's Health Night. No, we don't keep speculums in the office. So we can't be your primary care provider. However, for most things, you come to the neurologist. Because even if you have a sore throat and you call your primary care doctor, he or she might say, oh, it's your MS. And so you're calling us anyway. The goals of comprehensive care are to diagnose and treat MS, prevent or alleviate disabling complications, improve functional status, and address the emotional, vocational, and other lifestyle concerns of people living with MS and their support partners. How do we do this? We educate, we assess, we evaluate and treat physical, cognitive, and psychosocial domains. We hope to empower you to be a partner in your care and not just let us drive the bus. We want your opinion on where the bus is going. We work with insurance companies to understand the long-term needs of people living with MS. So, unbeknownst to you, outside of your doctor's visits, most of the MS specialists that you know in this area are working with the MS Society and other MS advocacy organizations to try to decrease cost of MS therapies, to try to to even advocate on Capitol Hill in Tallahassee, to increase access to care, increase the number of physical therapy visits that you get per year. Ultimately, comprehensive MS care should minimize the negative aspects of MS, maximize function, minimize suffering, reduce the use of dangerous or expensive treatments, and reduce overall healthcare costs associated with secondary complications. So here in Jacksonville, we have Partners in Care, which is the National MS Society has certifications for MS centers, and you have to meet certain criteria based on the number of people you serve who live with MS. And so some of those things are having an MS nurse, one MS nurse to X number of patients, and it has to be a certified MS nurse. What are you going to do with physical therapy with your MRIs, if you need a social worker? So Baptist Neurology at the Beach with Dr. Snyder, my old practice, is a Partners in Care center. UF Health at Shands downtown is a comprehensive MS care center because they have everything right on site. So, you know, you go get your MRI there, you see the physical therapist there, the social workers there. Whereas at Baptist, we don't have to, but we often choose to farm things out, even though we have most of them on site. I don't work there anymore, so I can't get upset with me for saying that. Cut this out, Stu. So what are the domains of comprehensive care? Well, they have to do with a lot of your MS symptoms. So anxiety, bladder, bowel, sexual dysfunction, cognitive dysfunction, depression, fatigue, mobility, falls, pressure ulcers, relapses, spasticity, speech, swallowing, education, health promotion, general preventive care, referrals for community programs, dealing with insurance issues, and the final piece, which is the last part of the talk, is making sure that your support partner is okay. And so you can see that as MS becomes really more complicated, because as of last week, guys, we have 18 disease-modifying therapies for this condition. As MS becomes more complicated within the specialty of neurology, the subspecialty of MS grows, and we have more people referring to MS specialists from the general neurology community. So here's a little wheel that I neglected to put integrative medicine in there. So imagine that it's there, because it should be. But that's you in the middle, a person with MS, and those are all of the parts of the team that you might need. And again, it looks like a lot and it looks overwhelming, but it's better to have them when you need them than to need them and not have them. Thank you very much. Even all my coffee today couldn't finish that sentence. MS care requires an interdependent team. So that also means that we all need to be talking to one another. Because what's the good of you seeing all these people if you're not talking to one another? If you come to an appointment and forget your medication list and you can't remember the medications that you're on and you just saw the urologist and he never sent me a note, what am I going to do? I've taken to just calling people. So I feel like I've developed over almost 20 years of being here good relationships with the people who I refer to. And as wonderful as the electronic medical record is, I'm crossing my fingers there, but as wonderful as it is, it totally decreases human communication. And so now I just pick up the phone. And I know that when I call a physician specialist, and sometimes a nurse practitioner or a PA, if it's Tuesday and it's a non-emergent thing, I know they're probably not going to call me back till Friday. I'm not going to call again. I'll give them some time. But it's easier for me to just talk to them than to send them my note and think they're going to read it, because it's just going to get scanned and put in the electronic medical record. So no significant task can be accomplished without the help and coordination of every team member. We all specialize in something different, even when we have the same role in a clinic. And the success of every individual is ultimately bound to the success of the whole team, and that includes you. So if you don't feel like you're winning with your healthcare team, just kind of take a look around and see who it is and what you can do to make it better. Support partners. There's a movement in MS care to really address the needs of the support partner and the support team. And that doesn't necessarily have to be the person you're with the most. It could be all the people here in this room that you see on a very frequent basis, because truly it takes a village to deal with a chronic condition that you're going to live your whole life with, and you're going to go through this life cycle. And guess what? The person living with MS might be the one who's healthy and ends up being a caregiver for their spouse or loved one, and ends up living beyond the life of their spouse or loved one. And so then what happens? Then how do you manage your needs? So people who are support partners could be friends, they could be families, they could be neighbors, they could be people in your Facebook group, they could be your healthcare providers. It's all part of this big village. They could be community resources. They could be the person who comes in as a home health aide a couple of times a week to help you out. Statistically speaking, the support partner is usually a spouse, sometimes a parent, and sometimes less a sibling. 1 in 4 millennials are caregivers in general. So this isn't just for MS. These statistics are in general for most medical conditions. Families provide 80% of long-term care in general. Because of the demographics of MS, 3 to 4 women have it to 1 man. Most support partners for people living with MS are husbands, about 62% of them. Most of them have young families and are early in their careers. And again, that's just because of the demographic of when MS is diagnosed. In MS, the top 3 emotions experienced by caregivers are compassion, fear, and anxiety. The top 3 negative impacts are on finances, hobbies, and mental health of the support partner. And the top 3 positive impacts are on relationships with the person you love, children, and other family members. So I just did a webinar on this for the MS Association of America, and I was just really so moved by some of the statements that I read by people who are support partners in MS. But it also just really drove it home that, when we're sitting in an appointment with you and your support partner, part of your care team is with you, we need to be asking if that person's okay and if that person is getting their own medical care, taking their own timeouts, making sure that they're participating in self-care. Like, what was that quote, Laura? Self-care equals taking your power back. And you've got to, it's that good old darn it, it's corny, but when you're on an airplane, you put on your oxygen mask first. Because if you don't, then you can't help anybody else. And I've learned that, just being a new mom. I can't make my son dinner if I'm about to pass out because I haven't eaten in 24 hours. So I don't do that, but you know what I mean. I'm exaggerating. So care partners in MS, women who are care partners report increased levels of burden or stress, increased medication use for these things, and more health concerns. Men who are care partners report more physical concerns. They're less likely to tell their primary care provider about their role, and they actually, at the end of the day, have much greater health risks than women. So this makes sense, kind of culturally. Women talk more about feeling stressed out and their feelings, and men usually don't, and, my back hurts or something like that. Children really are just not equipped to handle the primary caregiver role. And this extrapolates even to older teens and young adults who are, trying to make it on their own in the world. Most people spend about 24 hours per week in the care partner role, have an average age of 52 years, miss about 18 days of work per year if they're still working. will change jobs at about a 10% rate because of the role, and have more burden or more perceived burden when a person has a primary progressive or a secondary progressive form of the disease. And that's probably because there are more things happening, right? So there's more to take care of. Oh no. Does that mean it's dead? Yes, because this is the best slide. Well, that was such a bummer. So whether or not the person needing care had a choice, the majority of people caring for a loved one with MS would say the role made them closer to their loved one. So, you as a person living with MS who needs some kind of support, whether it be emotional or physical, you might be saying, get away, I don't want you, I don't need you, it's not time yet, this is too, the care partner would say that the role made them closer. So I just think that's a really sweet statement, because a lot of us walk around, on both sides of the story with, oh, we feel guilty for this, we feel guilty for that, and then the other person, everybody's just feeling so guilty, and then nobody wants to talk about it, and that's when things start to derail. And I think if you remember at the end of the day that you got into this because you loved each other, that's the best place you can start. Self-care for the care partner or the support partner means taking regular time outs, not getting sent to them. So, it's a lot better for you to just, as a rule, say, hey, this is my day to go fishing with my buddies, than having your buddies pick you up off the floor and be like, dude, we got to get you out of the house, Connecting with other support partners like you do at these dinners, making time for exercise, hobbies, eating healthfully, developing a plan for stress management that doesn't involve drugs and alcohol. And I say that not so much in jest, really for real. Making sure that you keep your routine medical appointments. Nothing hit home more for me about this than, I think it was last year, a woman who I've known for a very long time with MS, who's very well supported by her dear husband. She came with a daughter. She always comes with her husband. And I'd noticed over the course of the past year that her husband was looking just weary. He was looking weary. And there were older parents involved, that they were also involved with their care. And I thought, oh no. And when I said, well, where's the husband, let's call him John, he'd had a stroke. And, I know the stroke isn't my fault, but I also know that, man, I should have followed my gut, and I should have been asking him what he was doing to take care of himself, and what he was doing to, was he going to his doctor on a regular basis instead of just managing her care? And that was just a real wake-up call for me. So if you guys know people who are caring for people with anything, the best thing you could do as a friend is to make sure that they're supporting themselves too. If you're having to lift or transfer or bathe or toilet, learning proper body mechanics, and you can actually do that with a physical therapy evaluation of your own, or you can go with your partner to physical therapy and learn techniques. Practicing positive self-talk, positive affirmations work for everyone, and then identifying what you can and can't change. So there are just things that will be. There's nothing you can do about them. All you can do is change your attitude around them. So we definitely can practice our reactions, right? Turn our reactions into better, more positive actions. Effective communication should be very frequent because MS is unpredictable. And so, you have to kind of learn that rhythm, right? I know some of you guys as a whole have been living with MS for like decades. And so I'm sure when you first started out, it was like the good day, the bad day. Is it a good day? Is it a bad day? I'm going to walk on eggshells. But now you kind of have a rhythm. You can look at each other and, you don't even have to say anything. It's a bad day. It's a good day. you know? So that communication should be frequent. You should speak in specifics, in I statements, and without blame. So I feel angry, not you make me feel angry, right? You own your emotion. Listen, confirm, without interruption and without judgment. This is my big warning. So problems that existed in your marriage or in your relationship with your support partner, be they a friend or a family member, that were present before MS came into the relationship, they're not going to go away. They're probably going to get worse. So it's really important that if you have issues in your marriage and your love relationship, you know, problems with your sister who's living with you and helping out, you guys just get yourself to a counselor and learn how to communicate. Communication resources, planning together, being clear about your needs, discussing advanced directives, and a will or a living will, healthcare surrogate regularly, making a list of alternative helpers. So, you know, when Dave is sick, you know, we can call Mary. Getting FMLA papers filled out for work before you need them, making timeouts for health and respite for both of you, and listing problems and solutions in detail. And I recommend doing this on a regular basis. You know, maybe quarterly. It's like, you guys, I feel like it's fallen out of favor, but remember when you were in elementary school and you had to do like the fire drill? You had to review the diagram in your little school, you know, multiple times per year. This is like your fire drill. And sometimes it needs to change because some windows close. And then considering counseling, if you just don't feel like, if you feel like you're hitting a brick wall with communication, I would definitely consider counseling. And that's it. Stu's over there with a whip.
Yay, Megan. I love hearing her. I would bring her all around the country. So Laura, I told you, is a physical therapist, and Laura has been featured on numerous local TV shows, The Melissa Ross Show on NPR, and various print articles such as Jacksonville Magazine's Top Docs edition in 2017. In addition, she was awarded Jacksonville's Athena PowerLink project, one of the only 35 offered nationwide targeting women-owned businesses that are at least 2 years old and beyond the initial startup difficulties. After beginning her career at Mayo Clinic in outpatient orthopedics and leading the rehabilitation department in the area of pelvic health, Laura established Smart Body Physical Therapy in 2004. While at the Mayo Clinic, she also worked in the Multiple Sclerosis Clinic and was able to have the unique opportunity of treating pelvic health issues for people living with MS. Laura pioneered the way for the largest public health specialty practice in the southeastern United States. That's great. Thank you. She has a hands-on, one-on-one approach while treating patients in this highly specialized area of public health. I could go on and on and on talking about Laura. Let's bring up Laura and let her tell you. Okay? Thank you.
Okay. Thank you guys for having me tonight. Megan, thank you for inviting me. I feel I'm humbled and honored by being here with you, and I consider it a real privilege and a gift to get to share with you tonight. I hope you find the information useful. I hope you learn about something that will be able to help you with an issue that you didn't even know there was help for. So let's get started. I'm going to just give you an overview of what we're going to address tonight, and then we'll get into the meat and potatoes here in just a minute. I'm going to give you an introduction to the benefits of physical therapy for those who are living with MS. Most of you, have any of you had an experience with physical therapy? Anybody ever been to physical therapy? Okay, all right. Not everyone has, not everyone's even heard of it. Understanding functional exercises for addressing some of the impairments and issues that you might have with MS, and then understanding the benefits of pelvic floor exercise or addressing some specific pelvic issues that you might experience. And when I say that, I mean anything between here and here, and I'm addressing male and female with that. I'll try to get this right. I did not put a picture of myself in my talk. The person who put this together did that, but it's there, so we're going to fast forward. Okay, so the premise from which we operate as physical therapists in general, and this is in our all of our documentation at Smart Body that we do, is that we believe that each of us can overcome some of our current body limitations that arise during our journey, and our body is brimming with powerful intelligence capable of healing. With MS, sometimes we're dealt a hand of some things that will not improve, but what I want to talk about with you today are the things that you can address. And oftentimes, some of the things that you are experiencing are the same things that some of my patients who do not have MS are experiencing. And what I have found is that oftentimes whenever we have a neurological disease, everything can get lumped in and blamed on that. And sometimes it makes people not really that interested in working towards or improving something. And I hope I can at least inspire you to give it a shot. So some things can improve and are related to some other issues, and we'll address those in just a minute. All right, so functional exercise. I have actually printed up some different exercises for you guys, and Ariel is going to go around with them. So this is basically making the most of what you have. So we preach exercise and movement and using your body, and everyone's heard the adage, if you don't use it, you lose it. But this is also true even if you have MS. So there may be something that you are not going to gain back, but you are also going to be aging and losing muscle just like all the rest of us, which is 0.5 pound of muscle a year that we lose as we age. Isn't that a lot? That's a lot. So whatever you did this year, or whatever you did last year to be fit and work out and all of that, you've got to do even more this year just to maintain what you did last year. So as we age and you start to feel like, oh, I'm just getting older, I'm getting a little less fit, and that sort of, yes, that's correct, you are. So you've got to work harder to be able to maintain it, and then if you want to gain some strength, you've got to work even harder. So I just say I'm going to retire one day so that I can actually maintain my fitness, because it's probably going to require 8 hours a day at that point. But so these 2 packets that are coming around, I didn't bring enough for everyone to have both of the packets, but I was hoping you would choose based on what your current level is. These are just some ideas. This is not a prescription for the exercise. In physical therapy, we will prescribe exercise so that you have it dosed like a medication is dosed. So you want your exercises dosed to you. So there's an exercise program that's going around that's very challenging or a little more challenging, and then one that can be done in a chair. So they're just to give you some ideas. If anyone didn't, I just took a guess on how many people, or as far as who would want the more advanced one or the easier one. If you didn't get the one that you wanted, you can email me and I will give you a login and you can get to it. We have all of these for an app. There's an app on your phone to be able to access these. And so I wanted just to remind you too that people who do not have MS come to physical therapy every day for a lot of these issues that you guys might be having, and just encourage you to be able to get moving. So I wanted to go over a little bit for those of you who have not ever had physical therapy. What is it all about? People ask me. I had someone ask me last weekend, "Oh, are you a massage therapist?" No, we actually evaluate your strength, your range of motion, and then we'll come up with a program to address the impairments that are found. So for someone with MS, it can be a very important, really one of your best ways to combat a lot of the impairments and a lot of the decline that you might begin to experience can be helped and assisted in physical therapy. But they're just like everything else. There are good ones and bad ones, or you might not like them. You might want to go to someone different. So don't give up if you do go and try one and you're like, I didn't really like that, didn't get much out of it. So a physical therapist will assess your range of motion, how well you can move. A physical therapist will assess your strength and your balance. So how well you can stand on one leg is very important in predicting your likelihood to fall. So it's an activity that we might design an exercise program around. And there are so many things that you can do that do not require any equipment at all. You just need to know what to do. And I encourage you, wherever you are, to have some sort of evaluation to at least establish a baseline even. And so they can come and outline where you are, and then if you have a relapse a year later, they can look at it and say, okay, this is where we were, this is what we want to get to, and you can kind of work around that. The exercise piece of it, I wanted to give you a couple of ideas of things that you can do no matter where you are or what kind of level that you are at, and encourage you just to try something. So you want to do your very best to prevent further decline. And as far as exercise goes with MS, it's not, most of you know, or maybe you don't, but you don't want to necessarily exercise to fatigue like you do with a traditional workout program where you're just completely exhausted, because a lot of you, if you do that, that means you're not going to be able to fix your dinner tonight or that sort of thing. So depending on where you are with things, you've got to design your exercise program around what you have to do and accomplish later on in the day. Some of my patients who have MS might do their exercises in the evening so that it doesn't interfere with community activity that they've got to do during the day. So you can take all of those things into account. You do still want to try to increase how much you are doing because of that muscle loss that we all experience as we age. So I gave you a few examples on the paper. Basically, what you want to do is you want to try to continue. So if you're doing weights this way, and you want to go from 12 repetitions of 2-pound weights to being able to do 15 repetitions of 2-pound weights. If you do the set, and that's why I wasn't really specific, sorry guys, there we go, about how many reps to do, because it's specific to where you currently are. So if you did 2 sets of 15 repetitions of a particular exercise, and then you did it for all of them, and then tomorrow you're completely wiped out. Can't do anything else. All right, so you still do the exercises again, but you do 2 sets of 12. Does that make sense? So you can kind of gauge it, and you want it to be based on where you are and where you're wanting to go. All right. No? Okay. So I'm going to move into the bladder stuff, and that's fine. We don't need it. I know my talk. All right. So there are a lot of different bladder dysfunctions that can occur. One of the main ones whenever you have MS is called a neurogenic bladder. It means that some of you are required to self-catheterize because you can't actually empty your bladder. It means that some of you have lost control of your bladder and or your bowels and have leakage of it. I want to talk to you about that because no one else is talking about it, and it's something I'm incredibly passionate about. Even though I've had lots of people say that I couldn't, I've built an entire practice around it. And everyone that works in our office specializes in this. And if you aren't near us and you need help with it, you can contact us and we will help you get connected with someone who does do this, because there are specialists for it. So I want to just show you guys the anatomy of the pelvis here and give you an idea of what this is. You can Google this, you can Google pelvic floor anatomy, but I just want you to have some sort of an idea or a concept of the muscles that are involved with bladder and bowel function. So in physical therapy, we cannot change the innervation, we can't change the myelin sheath, but we can absolutely change the function of the muscle. And some of you would have some of the bowel and bladder issues that you have even if you didn't have MS. I have people in the clinic all day long. So you definitely want to, at the very least, try to address it. So here's the pelvis. I don't go anywhere without it. All right, hands on the hips. That's the iliac crest, all right? So put your hands on your hips, try to find that bone, okay? All right. In front is the pubic bone. Genitals are below it, so the bone is right here. It's basically the bottom of your abdomen. And all of your abdominal muscles attach. They come right in here onto that bone, okay? If I turn my pelvis, or if I turned you on your back, and we peeled back the genitals, or we peeled back the labia, all of that red right there that you're looking at, that's all muscle. That's pelvic floor muscle. It is no different than your quads, your biceps. It's striated muscle. It's the kind that contracts. That means it can get weaker. That means it can waste away. That means it can get You can get a Charlie horse in it. You can have a spasm. You can have pain. You can strain it. You can pull it. You can pull it just like you can pull your hamstring. I treat people all the time that went to the ER for it, and the doctor was like, I have no idea what's wrong with you. All right, so it's a lot of muscle. It goes clear from the front, that pubic bone, all the way to the back, and it attaches onto the bottom of your spine, onto your tailbone, okay? And then it goes clear from hip to hip, one side to the other. So when I do an examination, either vaginally and or rectally, I can actually feel the inside of the hip. So we think about those. They're certainly in different buildings if you go to a hospital to see someone about them, but they are literally right next to each other, but in healthcare we really have them divided out. So we pull it all back together, we treat it as one pelvis. I call it what's like a big bowl of fruit salad, basically. All right, so I'm gonna pull the organs out here, and this is a female pelvis. So we have bladder, uterus, and then rectum. And here, the little alien looking part, those are the ovaries, okay? And those sit down right on top of the pelvic floor, like that. Okay, well, they're a little more organized than that, but that's how they sit. So without that pelvic floor, though, if you want to look inside, she's zip tied together so she won't fall apart, but without that pelvic floor, your guts would literally fall out. There's nothing else holding them in, okay? And some people actually do have organ prolapse. Things fall out, they got to push it back in before they even sit down. I know that sounds horrible, it's just very real. Sometimes urine falls out unintentionally, sometimes stool falls out. So this is from Brene Brown. I didn't write credit on there, but she absolutely is the one who came up with this, which is self-care is taking your power back. So it doesn't matter who you are, what you're going through, what season of life that you are in, taking good care of yourself will give you some power over your situation that you're in. And so that's really what physical therapy is all about. All right, so bladders. So these are the different types of bladder issues that you can have. All right, so you could have urinary retention, you can have urinary leakage, or you can have that neurogenic bladder. There are different reasons to have urinary leakage. People think that just because they're leaking that it's because the muscles are weak down there, but that's not always the case. You want to be evaluated. But I'm going to give you some tips that you can already try at home. You don't even need to go into a doctor or anything like that to address it. You can just try them over the next 3 days. And I would just encourage you, if you are having any issues with your bladder, to talk to your provider about it or go see someone in pelvic health about it, because we just tend to kind of deal with it. We don't want to talk about it. It's not something you're going to share with your girlfriends. It's not usually something you're going to share with your family. Bladder issues are the number one reason, bladder and bowel are the number one reason for nursing home admissions. So it's also scary, very scary stuff. So a neurogenic bladder, which is most often correlated with the MS, is going to be your hyperreflexive or your hypotonic. So in other words, catheterizing or losing your urine, okay? It's a big problem, and most people have issues with it. Lifestyle changes can play a big role. And I like to put this up here. The definition of urinary leakage is any unintentional loss of urine. Some people will come into my office and say, oh, I just leak whenever I cough or sneeze. I don't have any incontinence. That is, you did not intend for those fluids to leave your body. That is incontinence. That means you're lacking control. It might not be enough of a volume of leakage that you have to go change your clothing or something like that, but that doesn't typically get better with time. It typically gets worse as the elasticity of our tissues declines later on. And then the other thing that I tell my patients and everyone that I know basically is that just because it is common does not mean that it is normal or that you have to just deal with it, okay? There are some of the things that you all are experiencing or your loved one is experiencing that are incredibly common, and just because you could literally name a dozen other people that have the same problem, that does not mean that you cannot address it. It does not mean that it is something normal and that you should just accept. There are 3 different kinds of leakage. There's stress incontinence, which is if you cough, sneeze, jump. It's not stressed out, it's actually a stress on the body. And so that means that the pressure on the bladder is exceeding the pressure that the sphincter can put on the urethra, okay? Urge incontinence is whenever you can't quite get to the bathroom in time. You had the urge to go, but you can't really get there. And then mixed is when you're lucky enough to have both. All right, so things that you can do. So right off the bat, caffeine, artificial sweeteners, and alcohol. You can get rid of those. Whatever kind of issue you're having with your bladder, our bladders are very sensitive to these types of things. It does not mean you can never drink them again, but if you are drinking a diet soda for, all of your nutrients during the day, you are just really putting your bladder into a difficult situation, and it's probably letting you know about it. Alcohol and artificial sweeteners, all of those things, you can maybe tolerate some of it, but if you're having any dysfunction, that's usually the easiest thing. You can just wipe them out, replace it with water. Or if you really want to have your cup of coffee in the morning, you're just not willing to let go of it, have a big glass of water before you hit your bladder with that caffeine. And sometimes that'll dilute it. The other thing that you can do is before you go to bed, if you're getting up at night to go to the bathroom, 2 hours before, cut your fluids. Drink water all during the day, but not before you go to bed. That way you're not getting up at night. That's men and women, okay? If you're hurting, that's a different story, and you need to talk to your neurologist or your gynecologist. If you're hurting while you're urinating or trying to get there, okay? It might still be something we can help, but you need to be screened for some other issues, okay? Home exercises for the pelvic floor. So I'm going to just teach you guys about the pelvic floor muscle. This is for men and women, and I'm going to do my very best to hopefully have you experience this and feel this. So I want you to sit up really tall in your chairs, and I want you to place what's called the perineum, or feel like perineal body. So this spot right here. So behind the vagina or behind the testicles and in front of the anus. That's the perineal body. That's where all the muscles kind of converge together right there. So if you sit up really tall and see if you can maybe even tilt your pelvis forward a little bit so you can have a little pressure there. What I want you to be able to do is to feel if you're contracting that muscle or not. Now what's really difficult about this, and why I've basically made a career around this whole area of the body, is that you can't tell if I'm contracting my pelvic floor right now or not, can you? Can't see it. It's all tucked up inside of the body. It's hidden away. It's really difficult to connect with it because you can't see it, right? If I'm doing my bicep, you can look in the mirror, okay? So you're going to sit up really tall, and what I want you to try to do, I should show you here, I want you to try to lift the pelvic floor up off of the chair. All right? Now, if I saw you move your whole body, then you moved other stuff, okay? So do your very best. It is smaller movement. I probably say about 1,000 times a day, don't try so hard, okay? It's just, it's like winking, okay? You don't need to do your whole head. I am winking also, okay? You want to lift. So this pelvic floor is gonna rise up inside of your body like an elevator in a building. And you wanna just give it a good lift and then let it back down. It's just as important that you let it back down as it is for you to do the lift, okay? Anybody feel it? Can anybody tell that they did it? It's hard to feel. When you're at home, you can check, you can palpate it. That means you can touch the area to see if you feel it moving or not. You can use a mirror to check it. There are some tools. I'm going to show you guys this tool. There's really only a tool for home for the ladies. The men, I'll show to you just a minute. So this is a pelvic floor educator. This is my favorite way to work at home. It's cheap. You can buy them online. So this is something you could do you could use it for coordination of the muscle. So you would lie down on your back with it inserted just inside the vagina. And then when you have it in, you pull the muscles up and in, and you see the stick move down, and you relax. So you have biofeedback at home, right? Cheap, easy to see, I know, right? It's crazy. But this is real. I mean, this is like the best thing ever. So it's so helpful. And whenever you're not, it's different. When you're working out and you're doing your biceps and stuff, you're working the right muscle. This kind of thing, I have people come in working it for 10 years, and I've been doing that stuff for 10, 15 years, it doesn't help. And I check them, I'm like, I don't know what you're squeezing, but it wasn't your pelvic floor. So you're doing something else, okay? All right. So biofeedback is something that we use, as well as neuromuscular education, which is a small electrical current. It's just a little 9-volt battery, so it doesn't hurt. It's not going to electrocute you. And then the lifestyle changes. So exercising, being at a healthy weight, all of those things will help with bowel and bladder function. And I have a little video coming up here. None of your exercises for the pelvic floor should be painful. You should be able to contract and relax. If it's hurting or your tailbone hurt after you did them, you tried way too hard. It's just a gentle contraction. It's like raising your arm up, let it down. Raise your arm up, let it down, okay? You want to exercise it until generally that you're fatigued. If you're sore the next day or hurt when you went to the bathroom the next day, you did way too much. You tried way too hard, okay? And then just a note on here to make sure that you are completely relaxing. Biofeedback is basically, it means you get live feedback, okay? So you could call a lot of things biofeedback, but this is a specific piece of equipment designed. It looks a lot like an EKG for your heart, and it is designed to give you real live feedback. So we can use this system to help retrain the muscles that are here, because you can't see them. You can't see them when you are working them out, you're contracting them, you're relaxing them. This allows you to visualize that that particular screen that you see right there is helping someone be able to relax the muscles and open them up so that they can have a complete bowel movement. Thank you. So it's basically a computer. It's a few little stickers, basically, like what you would have on an EKG, and they go right here. Men and women, they can stick right on the outside. We used to use an internal sensor or something along those lines to give feedback, and we moved to just the little stickers on the outside. It's way more comfortable, and no one's upset about us not putting something in their bottom. So you get this visual line, and then you exercise with it, and you're able to move it up and down and get it to relax or whatever we've set the program for. So it's a way for you to learn how to do it. Because it's one thing to say you need to do them, and then you get home, you're like, how? It's not working. So it's called a pelvic floor contraction, and it's designed for you to strengthen to either hold back urine or bowel, or working on coordination to relax the muscles so that you're able to fully empty. And we have had we've had patients who are catheterizing that are able to sometimes get off of a catheter. It just depends on all the reasons that are going on. I'm not making that promise, but it is something that's certainly worth looking at and trying to address. Some people who are struggling with urinary retention, getting up at night, leakage, wearing pads, all of those types of things that you want to at least try, and be able to see if there's anything that you can do that will improve your life, basically. So that's it. I'm done.
I'm going to run around the room because that's what I like to do, all right? So if you have a question, I would like you to raise your hand. Let me acknowledge that you have a question, and then I will be to you, all right? Please address to Laura and Megan which one you want to answer the question, okay? But if you both can stand over here, then you'll be in better light. You'll be in better light, too, all right? So who's got the first question right here? Great.
Recommended daily allowance for MS patients. I mean, I know how you are on supplements, but you said something about the recommended daily allowance for MS, like vitamin C, you could take too much. And then you said something about some herbs and vitamins might worsen MS.
So first of all, I'll address the vitamin C question. So vitamin C is a really powerful antioxidant, and so theoretically, so this hasn't been proven in big clinical trial, but theoretically, we wonder if people take too much vitamin C, if it could make their immune system overactive. So in a regular multivitamin, I think there's usually about 250 milligrams, and we usually don't recommend that you supplement beyond that. However, you can eat you can get vitamin C in food and citrus foods and bright colored vegetables. And that is kind of, people will, periods of time during the year, like flu season, cold season, they'll start, I'm just going to take echinacea every day. Probably not the best idea in MS. In fact, there are warnings on echinacea in natural medicine databases for MS specifically. And then herbs and supplements, same thing. So herbs and supplements that you read about or that your neighbor Betty tells you about can boost your immune system, and you should take this because you have an autoimmune disease. Again, theoretically, they could worsen MS because your immune system doesn't work right. Sometimes some of these things are fine for short-term use, like maybe 1 or 2 weeks, but I would just make sure that you talk to your healthcare provider before you start taking this stuff, even if it's over the counter and seems pretty safe. So Biotin for MS is a different story. So very high dose Biotin has been studied in MS, and there have been, I think, 3 or 4 small trials, maybe more than that. One of the trials showed an improvement in vision. One of the trials showed an improvement in walking. But then one of the first trials, when people were followed longer, actually showed that those people had an increased number of gadolinium-enhancing lesions. So until we have more data, I tend not to recommend high-dose biotin, but that's my practice. Plus it's really hard to get to that high dose. But from the standpoint of your immune system, high-dose biotin I don't really think can hurt you. We just are not super sure if it's the best thing for MS yet.
Megan, you had mentioned that women, when they're pregnant, don't typically have exacerbations. Are they doing studies about how hormones might be affecting your MS?
Yes. So University of California at San Francisco, they have a lot of research going in hormones in MS, not just female hormones, but also male hormones. And so estriol is the estrogen, the component of estrogen that's really high when you're pregnant. So they looked at, well, can estriol be used as a disease-modifying therapy? And they looked at comparing Copaxone to estriol. And the preliminary results were good, but then once you got past a year, everything ended up being about the same. So we don't recommend hormone therapy specifically to treat or to modify MS right now. That's a good question, though.
He owes us money for that phone ringing up there. That's it. I'm done with him. Next question's over here.
My question is for Laura. I may have missed it, but I didn't hear you address acupuncture for bladder improvement, control of bladder improvement.
You are correct. You didn't miss it. I didn't talk about acupuncture, but acupuncture can be helpful in addressing some bladder symptoms. And it's not an either-or thing. You can do acupuncture in conjunction with all of the things that we would do in physical therapy and the things that Megan discussed tonight.
Excuse me. This is addressed to either one of you, but there's been a lot just recently in the newspapers about medical marijuana, CBD. I've heard it from individuals who actually have MS and who are taking it. Is there a place in MS treatment for that type of chemical?
Okay. So yes, there is. So the American Academy of Neurology has looked at all of the available research for cannabinoids in various forms, so inhaled or vaped or oral cannabinoid extracts, and we're speaking about medical marijuana. They've looked at the available evidence. There's actually a document that you can look at online that outlines that for you as a patient versus a healthcare provider. That's pretty easy to understand. But actually, Neurogenic Bladder can be helped by medical marijuana. Spasticity, severe spasticity can be helped by medical marijuana. And nerve pain, neuropathic pain can be helped by medical marijuana. The caveat is there's no there's just no structured body that tells us how much is too much, or, I don't even know, hundreds of thousands of strains of marijuana. And what we also know about it is that it because of studies, is that it definitely impairs cognition in people living with MS, and it can impair balance. And it's still a psychoactive substance, which means it could affect your mood, it could interact with your medications. So it's, yes, there's a place for it, very individualized decision to make with looking at your whole health and your other medications. As far as CBD oil goes, now I'm speaking about CBD oil, like the kind that you can just go to the health food store and get, or again, your neighbor Betty is selling it and it comes from Colorado, So CBD oil without a medical amount of THC, do you want me to stop? Okay. Has very limited data in humans, much more in animals. Well, this is true of a lot of the things that we do, right? Lab tests, supplements, that sort of thing. So that being said, you have to think about the CBD oil that you get from Native Sun, Whole Foods, your neighbor Betty, or even your 80-year-old mom. As a supplement. And supplements aren't regulated, which means what's in one bottle 1 month may not be the same thing that's in the bottle the next month. And you have to be careful about adulteration, which means there are other things in there that aren't intended to be. So I hope that answers your question. I do think there's a place for it. And it's a growing place as we get more science.
I just want to add something to that for those that might be using it. You also have to check with your employers to find out if they're even going to allow you to be using this. I mean, just like they don't want you to come to work drunk, they're not going to want you to come to work, stoned. Yeah. All right. So, you got to watch out for that, because I've heard this is a major problem even in California where it's recreational, but the employers don't want it in their place and they don't want to hire anybody that's smoking. So, you got to watch out for that. Okay.
Yeah, and I'm speaking in Florida. I know this gets broadcasted, and I'm not familiar with, the laws of every state. So Stu's coming around.
I forgot for a second.
Oh, I was just wondering, how do they have that medical marijuana? How do they have that medical marijuana? Is it in a pill, or they smoke it? Or?
So it can be smoked, like an oil. It can be vape. Well, so the oil's vaped. It can be smoked. It can be in patches. It can be ingested, so like an oil that you drop on the tongue. I'm going to say, unfortunately, when providers are educated about medical marijuana, or they become certified to do it, they're not necessarily sitting in really, it would have to be, in my opinion, like a 5-day lecture from 8 to 5, learning about, what strain is better for this, what strain is better for this, how, your doctor just gives you the card, and then you go to the pot shop, and the person behind the counter tells you what you need. And that person doesn't necessarily have any medical education. So, so there's that. We don't recommend smoking marijuana as a rule, just because of the negative effects that it could have on the respiratory system. We have no idea what vaping oil will do to your lungs. That being said, one of my faculty from my Integrative Medicine Fellowship, who runs the Stanford Integrative Medicine Cancer Center in California, will say that it's probably best to vape because the effects are more immediate versus, somebody tells you to get an edible and you bite off a piece and 30 minutes go by and nothing happens, so you take the whole thing and 30 minutes go by and you don't really feel anything, so you take another one and the next day you're in the ER. So.
And I know somebody that uses a vaporizer.
Yeah, you can vaporize it too.
Right.
Yeah. It's like the 60s.
Oh. Thank you so much for saying that we need to get a care team.
Yeah.
But you mentioned about a social worker. I'm not real sure if when I get ready to bring this team together? Should
Yeah.
I start with the social worker?
So it's the hardest thing to start with because there aren't many. You know, most of the time you have access to a social worker, it's because you ended up in the hospital and then someone's trying to coordinate your care when you go home. Social workers can be really useful to help you do that at an outpatient setting, but a lot of hospitals can't afford to pay for them, to have them around. You know, they can help you navigate your insurance system. They can help you make appointments. Some of them are even licensed mental health counselors. So I would just, whoever you're seeing, I would ask if you would have access to a social worker if there's one in that clinic. I would honestly, I think, you know, you need that neurologist or PA or NP and an MS nurse. Those are your two most important pieces. And then probably the third is the rehab specialist, the physical therapist. But I'm biased.
And those are the easiest ones to
Yeah.
access to,
Yeah.
because, yeah.
You got it. Mary's sister, Rosie, knows everything about medicine, of course, so she investigates everything. She came to Mary today and mentioned functional medicine.
Yeah.
And you mentioned functional medicine along with, is there a difference between that and integrated medicine?
Yeah, so there is. So integrative medicine has a lot of tools in the toolbox. Functional medicine is one of those tools. And there are a lot of pieces that overlap, particularly the emphasis on nutrition, the emphasis on exercise, the emphasis on looking at a person's whole health story as what made you turn out the way you are. I think that functional medicine comes from a bit more of a biochemistry naturopathic standpoint, and so they also believe that everything starts in the gut, and so if you heal the gut, if you heal up that microbiome, then you decrease inflammation and everything else will follow. There are many sophisticated lab tests that traditional medical providers would say aren't well validated. There are oftentimes, in my opinion, too many supplements prescribed for things that you can do between your head and your feet all on your own. So functional medicine for me is a tool. For some people, it's completely the way they practice. That's a good question. Yeah. It's a great tool.
Question for Laura. I don't think you spoke about it today, but what can you tell us about like a movement issues like hip flexors that don't work for people who sit too long?
As far as how to get around still, if
Yes.
you have a piece missing. So,
Yes.
Well, one of the best things that you can do is actually work with a physical therapist to figure out some accommodation or adaptive movement. There's always some other way. Our bodies are just able to do so much with other areas of the body. It's like this basket weaved together. So there's almost always a backup system or almost always a backup muscle for you to get to move. For example, your hip flexors make your leg do this, but your abdominals also pull you forward. So if you have someone that is working with you that understands those innervations and those movements, there's usually a way that you can work around it to be able to accomplish the movement that you're trying to get.
Great. Well, thank you for that. Also, somebody asked me that they're having a lot of problems with joints of their body, and I don't remember how old this person is, but he was wondering, he had heard something about connective tissue disorder, but doesn't know where to look for anything about it, and he's not internet savvy. What can I tell him?
Are you talking about someone who just has some joint pain in
Constant.
general?
Yeah.
Constant. Okay. So that's a very big question, a very broad question. It could be a lot of different things. It could be something simple like a lifestyle changes and diet, like what Megan has addressed. There's an entire new body of knowledge and literature called the Neuroscience of Pain, and this is something we educate our patients in on a daily basis. But you could have an actual disease process going on, so you should go and seek health care to screen that out. But once that's ruled out, once anything sinister is ruled out and you're still having pain, it's something that can be evaluated and usually addressed by a physical therapist. But then you also have the piece of it called the Neuroscience of Pain, which is a matter of understanding and learning about how we experience pain. So we used to think that pain was You pinch here and you hurt right there. There's a thing right there that causes, that actually reacts and has the pain. But we now know that you do not actually experience pain unless you have had it interpreted by your brain. So sometimes it can be something in your brain that is hyperactive, or sometimes it can be learned behavior, and that doesn't mean that it's all in your head and you're just, putting on or something like that, but it can be learned pain that you still experience, and we see it all the time. I can see someone who objectively has nothing wrong with that body part anymore. It's healed. Range of motion is good, strength is good, but they still have pain. And so we address that a little differently. But it would be someone who, if they've got, especially all over joint pain, you need to see a provider who is going to actually screen those things out, look at diet, Megan is actually the perfect kind of clinician to do something like that, and then have them get referral and get help based on what kinds of things could be contributing to that.
Thank you. I'm glad it's being recorded so I can tell him to look at this, okay? Excuse me, one question here.
Yes, Laura, I wanted to know how you felt about Botox injections for incontinence.
That's a good question. You typically see Botox injection for the opposite, which is where you have difficulty urinating. When you inject the muscle with Botox, it makes it relax. It doesn't rot the muscle, kill it kind of thing, but a low dose that they typically inject into the muscle causes the muscle to relax. Some people do really well with a Botox injection, and we might even see them for rehab after they've had the Botox injection if they're having difficulty emptying their bladder. It's not typically something that you should have if you're having leakage. Leakage you usually need to strengthen, but I mentioned in my talk, sometimes you can have leakage related to dysfunction of the muscle as far as it won't. It's more complicated than just whether or not it's contracting. So it's something you should have tried some sort of pelvic floor physical therapy before you consider it. I've seen people be worse after they got the Botox injection. They didn't know that they even had access to something like pelvic floor physical therapy, but it's something you definitely want to, if you have a physician who's recommending it, you also want to see something that's an expert in the muscle function as it relates to the bowel and bladder. We see bowel dysfunction as well, and I've seen them do it before for constipation, and then they end up in my clinic for fecal incontinence, for loss of bowel control.
Is that the same thing you would use for prolapsed uterus?
So the Botox?
Yes.
So Botox, it's the stuff that they use if you've got wrinkles and you want to relax the muscle. They can use it in other muscles or spasticity, like muscles of the neck or vaginal and rectal muscles. But for prolapse, just like the urinary leakage, you would not want to do Botox for that. So the prolapse, the organs come falling out of the body basically because there's not any support. That floor, right? It's either sagging or it's wasted away, or the opening is large if you've had a couple of 10-pound babies or 7 or 8 10-pound babies. There are a lot of different things that can either stretch, or you could just be deconditioned, or you could have loss of innervation. And so you would definitely not want to put Botox into the muscles in that situation.
Prolapsed uterus, would that come from when you have hysterectomy and you got your uterus and your...
So prolapse just means it's falling out. Anything can be prolapse. So prolapsed uterus means that your uterus is falling out. So if you've had a hysterectomy, there's something else falling out. Yeah. You don't have a uterus anymore. Yeah. But to address that falling out, and sometimes it's just the feeling of falling out that women have, and sometimes it actually falls out. But to address either of those, strengthening the pelvic floor is really crucial. And you can work on the contraction like I showed you during the talk, but there's a lot more that you can do to strengthen that pelvic floor than just that one little exercise. You can do tons of stuff, and we have a specific program for people who have prolapse. We actually have you do the exercises with you lying down on your back and your feet up on the wall and your hips elevated just a little bit, so that we can use gravity to our advantage instead of our disadvantage.
New question here?
Yeah, I have a question. I don't know if Hi, Megan. Or for Laura. Sciatic nerve muscle pain, lower back down to the legs. I've done the physical therapy. I think I've exhausted it because I'm getting more pain from physical therapy. What are my options?
So it could be that your physical therapist has not been able to address the things that are there. So the first thing is to decide if it's actually mechanical pain. And that means just like you take your car into the shop and they tinker with it and figure it out. So you've taken your car into the shop and he's messed with it and you drove it home and you're like, but it's still making that sound. That click's still there. What's going on? So sometimes you need to try a new mechanic. Sometimes you need to try a new physical therapist. Or sometimes you may need to go back to your provider and maybe get some imaging and see if there's something else that's not mechanical causing your symptoms. It can be related to some other things, some of that neuroscience of pain stuff that I was talking about, or even just an MS sort of pain. But if it typically musculoskeletal pain, or pain that would be in my wheelhouse for physical therapy, is something, the pain changes with movement. It either gets worse or better. It feels better or worse when you wake up in the morning, or it feels better or worse when you go to bed at night. It has some rhythm to it or some change. Sometimes it's hard to figure out what that rhythm is, but the physical therapist is going to be able to help you with the mechanical pain or to help you with accommodations and working around pain that you might have with MS. But I would start there. I would either try a different physical therapist, someone who, there are people who see that sort of thing all the time, and there are people who see sciatica or low back pain once a week. And so there's a level of expertise with that. And then if you don't, it's hard to know. You may or may not know or feel confident in the therapist that you saw. But and if you're not sure, you can always go back to a primary care provider or someone like that to have them do a little more screening for you to help you to direct you where to go.
Great. Next question. Anybody have a question? No questions? Everybody knows everything?
Can I just add to that, too? If you've exhausted your PT, you might want to try a different form of healing. So acupuncture can be really helpful for pain. Sometimes Reiki can be helpful for pain. If you have, speaking more to that neuroscience of pain, guided imagery, which is it's kind of like a guided meditation, but it's longer and it's, a nice voice and pretty music, and they're kind of talking you through the process of having pain and forgetting about it, is very, very helpful for lowering pain levels. And Kaiser Permanente, like the healthcare system in California, if you Google Kaiser podcasts, what comes up is a link to free podcasts of guided imagery that you can listen to, and then you pick the pain one.
And then sometimes, I appreciate you addressing when you're actually out of it. Sometimes you're out of insurance benefits, but sometimes you might be finished, or they might say you're out of physical therapy visits because you're out of visits on that particular prescription, maybe that they have, or that particular plan of care. So you want to call your health insurance company too to ask them and find out what kind of benefits you have. And you actually can go directly to a physical therapist. You don't have to have a physician's referral. But that I would just kind of differentiate that as far as navigating the healthcare system. That's a whole other animal besides just understanding about your health. But it could be a financial thing, like you're capped, or it could be for that particular episode of care that you're done. And might mean you could still go more. Yeah.
Thank you. Any other questions? Well, then let's say thank you to Laura and Megan. Thank you. That was great. I love the topics. I love the answers. I love the presentations. Thank you for everything. Thank you, everybody.